A warm good evening to one and all present here today for the webinar on awareness session on breast cancer screening and treatment modalities. Today we have eminent speakers Dr. Lakshmi Krishnan and Dr. Suresh Kumar to talk about the various factors involving around the cancer care. So Dr. Lakshmi Krishnan, an oral pathologist with a unique experience in the field of clinical research, technology, innovation for public health and scientific writing. To comment on a couple of her eminent projects includes the collaboration with IIT Madras, MCC and Tata. I would like to introduce Dr. Suresh Kumar, a radiation oncologist who has got years of experience in Cancer Institute of Adyar and have eminent service in the field of cancer treatment. Welcome you, sir, and welcome you, Doctor. Dr. Lakshmi, I would like to invite you to start the presentation for the day.
Thank you, Soumya. Thank you for the kind introduction. Good evening, everybody. Thank you for joining us today in this everyday pursuit of creating awareness towards breast cancer. As Soumya introduced, I'm Dr. Lakshmi Krishnan. I'm a senior clinical research scientist at Niramai. I would like to give a disclaimer at the very beginning that I'm a public health enthusiast, and this presentation will be from a public health perspective and will be in layman terms so that everybody in the audience can understand it. I'm from Niramai, and Niramai has developed an innovative AI-based breast cancer screening solution. Okay. Before we get into screening, we need to understand what is breast cancer and more about it. Breast cancer is a huge topic. We can go from awareness, screening, diagnosis, treatment, and supportive care. But today, we'll focus on only one end of the spectrum, which is we're trying to understand how to screen for breast cancer, how to detect breast cancer early, and what are the risk factors and signs and symptoms. Now, for those of you who do not completely understand the spectrum, I'll take a little liberty to explain what screening is. Very similar to what happened in COVID. Imagine if each one of us had to go and get an RT-PCR test done. The burden on the public health system would be too much. Also, the cost would be a lot. So what we did is when you had to enter a supermarket or when you had to go anywhere, they would use a thermometer to check your temperature. And if that was high, you were sent for further investigations. Or if there was any symptomatic, only those women were asked to go for further tests. Now that is what we are trying to do here. Instead of asking every single woman to undergo a diagnostic test, we are asking all of them to undergo a screening test. Only those who require, have a higher chance, a higher risk, are sent for further tests. Now, doesn't mean that everybody who go for a diagnostic test will test positive. There are times when you've got an RT-PCR test for COVID and you've turned negative. Very similarly, here you would go for a diagnostic test. And depending on what the output of the diagnostic test, you may have to come back after a year or you may need further treatment. So we'll be talking about that's screening and early detection. So we'll be talking about these different points today. Before we get on to, why are we even talking about breast cancer? Why are we not talking about any other disease? Why? This is not Breast Cancer Awareness Month, but we're still talking about breast cancer. And the reason is because it's the leading cause of cancer deaths in India. So we have this is as recent statistics as 2020, and this is comparing both male and female genders. We have around 180,000 cases detected every year. These are new cases detected every year. And we have half of them, almost 90,000 of women who die every year because of breast cancer. So out of every 2 women who are detected of breast cancer, 1 woman succumbs to the disease before 5 years. How do we reduce the number of women dying from breast cancer in India? Now, this is a map. As you can all see, it's a world map and it's all colored pink. And like most of you know, pink is the color for breast cancer. This is showing the most top diagnosed cancer in the world. And it's all pink. Breast cancer is so common throughout the world. But what is interesting is the next map. Now, this is the map of a top killing cancer per country. And you can suddenly see that in the US, it's no longer pink. Women, although being detected from breast cancer are not dying because of breast cancer. That's not the top killing cancer. But whereas in India, it is a top diagnosed cancer and the top killing cancer. Why do you think that difference is? Is it because our treatment modalities are not great? Of course not. We have one of the best treatment modalities. The reason for it is probably lack of awareness. We are not aware of breast cancer. We believe that breast cancer can happen to my neighbor, can happen to my relative, but not to me. And because of the lack of awareness, we go to the hospital at a later stage. And when we do that, it's usually at such an advanced stage that we may not be able to change the color of the map of India from pink to another color. So can we do something to not make breast cancer stop killing cancer in our country? Yes, we can. So like I mentioned, only 4% of the women who have breast cancer reach at a stage 1 or at an early stage breast cancer, which means out of 100 women diagnosed with breast cancer, 96 women are reaching in stage 2. So what can we do? We have to reach early. And how do we reach early? Because we have to detect early. And if we detect early, we can improve our survival rates. But before I get into what is breast cancer, we need to understand a little about breast. Kindly, all the doctors here who do understand the anatomy much better than me, kindly excuse the layman terms that I'll be using in this presentation. So for the general public, the breast, I can tell you, consists of 2 main parts. One, the function of the breast is to produce milk, right? So we have glands here. These are like small factory units which produce milk. You know, each of these units produce milk, and the milk is taken through this duct. We can call it like a channel, like a canal, and it reaches the nipple. So this is one component, one major component. This is the other component, the ducts. And then there is fatty tissue. Okay, fatty tissue which gives the structure, support, and form to the breast. Okay, so now when there is an abnormality, it can begin from this structure, it can begin from this structure, it can begin from the canal, it can begin in any part. Okay. Now, another thing that I would like you to remember is this green color thing that you can see. These are called lymph nodes. You could call them, it's a big network. The entire body has this. Okay. But today we'll focus on something that's near the armpit. Okay. Lymph nodes, which are near the armpit. We'll focus only on these. Does anybody want to tell me what is cancer? Please use your own, do not fear there are anybody here, but please, if it would be great if somebody could tell me, what do you understand what cancer is? Please feel free to unmute yourself, and I would be very happy if anybody could answer. Is there anybody who would like to answer? Soumya, people can unmute themselves, right?
Not possible, but if someone wants to talk about it, maybe I can give the access.
Okay, I think fine. Okay. Okay, so thanks to technology, I will not be able to receive your answers, but the common understanding is that any growth, unwanted growth is cancer. Now let's just, I mean, we all know Hrithik Roshan. How many fingers does he have? He has 6 fingers. So that's unwanted growth. Is that cancer? Probably not, because if it was cancer, he has it since his childhood. So probably not just any unwanted growth is cancer. Any unwanted growth, because that does not stop growing. Hrithik Roshan's 6 fingers stopped growing. This finger did not, cancer does not stop growing and is usually initiated without a reason, without a stimulus. So any unwanted growth and uncontrolled growth without a stimulus is called cancer. So it initially starts with, for breast cancer especially, most of the breast cancers start within the duct. And it starts dividing very rapidly and it fills up the space. Now, but if you can see, it's still not gone beyond the circular structure, which scientifically is called a basement membrane. We'll call it as a compound, okay? It's still within the compound. Here in this stage, it's called stage 0. Even in this stage, if cancer is detected, it has got a great chance of survival. Now, let's assume that this cancer cell comes out of the compound. Until this stage, it's called ductal carcinoma in situ. It's still within the duct, that once it reaches this compound wall and comes out, it becomes an invasive cancer. Now, at that stage, excuse me, it's called a stage 1 cancer, where it's still less than 2 centimeters. Now, at this stage, for example, if I'm the patient and I have a stage 1 cancer and I go to a doctor at this stage, the doctor might all do a simple operation of removing this cancer along with little normal structures. The entire breast will not have to be removed in most cases. And the treatment cost is much lower. So 3 things happen if I go to a doctor at stage 0 or stage 1. One, the treatment is very minimal. It's not very extensive. Your entire breast will not be removed according to popular perception that, oh, if I have breast cancer, they'll remove my breast. That's not true. If you go early, your breast can be saved. Only a small part can be removed. Second, the treatment is cheaper. It's much more lesser. And this is something that we need to speak about from the public health perspective, because not all of us can afford treatment. So second, it's cheaper. Third, and the most important one, is that your survival chances are much, much higher. If I reach a hospital at stage 1, my survival chances are up to 96%. Now, what happens in stage 2? Stage 2 is when the cancer becomes a little larger. It's between 2 centimeters to 4 centimeters now. Stage 3 is when the cancer starts spreading to nearby regions. It's still near the breast. It's not gone very far here. If you remember the lymph nodes that I mentioned, it started to infect the lymph nodes near the armpit. Now, if I go to a hospital at this stage for treatment, unfortunately, I will have to probably lose my breast, right? And not just that, I will have to, doctor might have to remove part of my other tissue also, like the armpit, and might have to remove all these lymph nodes. Now, what happens if I go at stage 3 is that there are chances that it's not visible, on the surgery, it's not green color. It could be, it's very much, it's all just blood. Red is the color on the table. So there are chances that, part of the cells might remain, and there's a high chance for recurrence. And of course, a lot of chemotherapy cycles will have to be given. So the treatment is extensive, and the survival chances are much lesser than you would have in a stage 1 cancer. Stage 4 cancer is something that most of you might know as advanced stage of cancer. This is the time when you might have come across the term metastasis, which means the cancer has not just spread around the breast, but to different parts of the body, like the brain, lung, liver, and bone. And this time, it's not possible to perform a surgery and remove cancer from every part of the body. So surgery is not really a way to cure the cancer here. It's not really possible in the last stages of cancer, and the survival chances are really low. So what do we learn from all of this? Is that we need to go to the doctor at stage 0, stage 1. And how do we go there? How do we know we have such a small cancer? And that is what is screening about. You don't wait for a symptom to occur. You go and get yourself screened from breast cancer, even at early stages without symptoms. Because most of the time, what we have noticed when we talk to women to get cancer screening is that I don't have any problem. I don't have any problem. Why should I go get myself screened? You need to go get yourself screened, even if you do not have any problem, every year. That is as simple and as important as that. So what causes breast cancer? You can say, hey, I'm not going to get breast cancer. I eat healthy food. But wait, there are certain factors that are responsible for breast cancer, and we have grouped them into 2. Non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors are risk factors that I cannot change, come what may. It's not under my control. But why are we talking about it if it's not under my control? Because if these factors apply to you, then your antenna need to rise up and you need to say, I need to go for cancer screening more. And very non-negligible risk factor is that you're a woman. Men do get breast cancer, we'll talk about it, but women, the minute you're a woman, your chance of your risk of developing breast cancer is higher. And also older the age, higher the risk cancer. This does not mean a 35-year-old woman will not get breast cancer. In India, in fact, we are noticing a trend where breast cancer is increasing in the ages between 30 to 40, 45, and breast cancer is becoming younger. But if I have to compare an older woman and a younger woman, the older woman has a higher chance of developing breast cancer. Menarche is the onset of periods, the first time you get periods. Menopause is the last period that you have in your life cycle. So an early menarche and a late menopause means you've been exposed to many menstrual cycles. Many times you've been exposed to the hormone called estrogen. And when that happens, that increases the risk for breast cancer. So let's say a girl who's 11 years old and has attained menarche, as compared to the girl who has attained menarche at 15, has a higher risk of developing breast cancer. Okay, but that does not mean just because I have had a menarche at the age of 15, 16, I will not have breast cancer. These are all risk factors which put you at a higher risk for developing breast cancer than the others. Same thing with late menopause. Then family history of breast cancer. This is something that all of us are aware. There's something called first degree relative, where we're talking about mother, sister, daughter. If my first circle of family has breast cancer, then I need to be aware that I might have a higher risk of developing breast cancer. I need to go for screening more often, irrespective of my age. The fifth point here is exposure to radiation. Now, there are diseases like Hodgkin's lymphoma, which occurs here. And as part of it, the treatment might contain radiation to the chest region. This might cause some changes in the chest, which we call mutations. They could be induced. And because of that, later on in life, there might be a chance of developing breast cancer. Now, all these features, there's nothing you can do. You can't decide when you're going to start your menarche, when you're going to have your last periods, or whether your family member is going to have breast cancer. You cannot decide any of these. And which is why they are called non-modifiable risk factors. But if any of these apply to you, you need to consider having breast cancer screening every year or even frequently after consulting with your doctor. Now, there's something called modifiable risk factors. And these are risk factors that I have some ability to control. I can probably change. The one of them is no children or late children. So if a woman has a first full-term pregnancy after the age of 35, she probably has a slightly higher risk. Now, when I'm talking about risk, it's as minimal as 1.1 time more than the woman who's had it below the age of 20. So if you have no children, or if you've had a late full-term pregnancy, you're at a slightly higher risk than the others for developing breast cancer. Same thing applies for breastfeeding. If you have not breastfed your child, or if you're not been able to breastfeed your child more than 6 months or 1 year, then the risk of developing breast cancer is slightly higher than somebody who's managed to feed their child for more than a year. Hormone replacement therapy is sometimes inevitable, and so are birth control pills. But you need to be careful on when you're taking the medication. Do not self-medicate, because anybody who is taking a hormone replacement therapy for 5 continuous years is at a higher risk of developing breast cancer. Now, interesting part about the research here is that if I was taking it for 5 years, but I'm not taking any more hormone replacement therapy currently, my risk is probably the same as anybody else. But when I'm undergoing hormone replacement therapy, research says that my risk is slightly higher than others. Well, smoking and alcohol consumption, I don't think I need to really focus on it, because everybody knows, not just for breast cancer, but for every other cancer, smoking and alcohol consumption pose a higher risk for developing breast cancer. The same thing applies to lack of exercise and obesity. People come and say, I do money kelsa, I do housework, I do work. That's not really counted as exercise. You need to let your entire body move, and you need to invest 30 minutes a day to perform exercise. And only then it probably has some kind of protection for you. So, but like I said, these are all modifiable risk factors. So what is the modification you can? When possible, if possible, I'm using these terms when and if, because I know it's not always possible. When possible, if possible, try and have a first full-time pregnancy, early full-time pregnancy. When possible, if possible, try to breastfeed your child for at least 12 months. I know many times it may not be possible, but when possible, please do that. And have a healthy lifestyle. I know the burger taste is very enticing. I know the bhaji is very tasty, but try and incorporate a lot of greens and yellows and oranges in your diet, a lot of fruits, vegetables, and leafy vegetables, and invest 30 minutes of your day to exercise. Now, you might not, none of these might apply to you, but if things have to happen, breast cancer can happen to anybody of us, right? We have the risk of around 1 in 28 women having the risk of developing breast cancer in their lifetime. So we need to examine ourselves every month, 5 minutes in a month, to check our breast. So this is called self-breast examination. Try shows lemons here. There's a nice page which is depicted it in the form of lemons. You need to look for 4 things. You need to look for, when this examination is done, you can Google. There are multiple videos which show you how to do a self-breast examination. All you have to do is look in front of the mirror. Ideally, do this on the 5th day after your period. For people who have had menopause, you can pick any day in the calendar. It could be a birthday. You can just pick one day on the calendar and remember to repeat it on the same day every month. For those who are menstruating, always pick a day immediately after your periods. Do not do it during your periods because you'll feel every part of your breast is numb, and it's of course painful slightly to do that. All you have to do is look into the mirror. Do not have clothes on the upper half of the body. Place your hands behind on the head and just observe. We need to see our breast more often than anybody else needs to. So you're looking for change in color, change in size, change in shape, change in texture. You're looking for if there is any change in color like this, a change in texture like this, a change in a shape like this, or change in size. Okay. You're also looking, you have to focus a little more on the nipple. Has the nipple gone in? Is there any discharge coming from the nipple? And if you keep seeing this every month, you will instantly notice any difference if you have seen. There are times when you might feel, oh, one of my breasts is bigger than the other. If it's something that you've noticed over years, which is most probably the case, you don't have to worry. But if you didn't see something last month and if you're seeing something this month, you need to go visit a doctor. Okay. After you look at the breast in the mirror, lie down on your back and start feeling your breast. You need to press hard and in circular motion and go across the breast, every inch of the breast. What are we trying to do here? We're trying to feel lumps in the breast. So we are trying to feel any structure. Now, there are times when you might feel a lump. Do not worry. Not all lumps are cancerous. There are a lot of benign conditions, but you do not take the call for that. You will have to go visit a doctor. The doctor will run a few tests and will tell you if it is a benign lesion or not. And most of the times it will be benign, but please do not panic that it will be malignant, and do not take the decision for yourself that it is benign. Okay. I have a video here, but I will skip it. There are many screening guidelines. WHO has a guideline. The American Society has a guideline. India has its guidelines as well. And unfortunately, in our country, we do not have a population level screening. Ideally, you should have something like the pulse polio. It happens throughout the country. We are working towards it. The government is working towards it. But until then, it is upon us to be aware of something called breast cancer, and that it can be detected at an early age. So I told you about self-breast examination. You're supposed to do that once a month, every month. At least once a year, go visit a doctor, even if you don't have any symptom. Go get this. Doctor will do something very similar like the clinical breast examination, self-breast examination, but you'll have to do, because it'll be done by a doctor or a healthcare provider. It's called a clinical breast examination. And there are other methods also, like an ultrasound and a mammography. Mammography is very similar to your X-ray. Mammography is very similar to your X-ray. What you see right now here is an X-ray. It's an X-ray of the breast, where your breast will be placed between two plates like this and compressed, and you can see. Now, one of the things that we see here is something written as fatty breast and dense breast. Fatty breast is is usually seen in older women. Remember when I had showed you what a breast contained, I had showed a lot of milk glands, factories producing milk are there. They decrease as we grow older. And that is when, we can call it a fatty breast at that time. Now, this is a small cancer seen in fatty breast, and it's very clearly visible. That's how good a mammogram is. In women who have dense breasts, this is younger population, which is more seen in India right now. In younger population, this is all the fatty glands that you can see, and there's a big cancer here, but you cannot really differentiate between them. A less experienced a person probably will not be able to, differentiate between this and might miss this cancer, which is why there's a new technology called Thermographics. It's a non-contact privacy aware. Nobody will touch you or feel you when the test is happening. It can be performed by a technician. So, we will, and only when the technician finds and the tool finds it as positive, all the important cases will be referred to a doctor. It will be, all the cases will be reviewed by the doctor, by the way. And it's a painless and radiation free. There's no radiation involved. There's no pain of compression of breast. And because of it's able to detect cancers in dense breast women, it can be used in women of all ages. I think I will stop it here, and I will ask Dr. Suresh to continue. Thank you. So, sir, I hope I have done a good job. So, over to you, sir. Thank you.
Actually, you covered all those staging. That's good to hear from you, because basically staging was the main thing, because most often our patients get confused with many things. So I think staging was very well covered.
Thank you, sir. But I think I've left the treatment to you because you know treatment best.
I add on few slides. Actually, how can I share my screen? I didn't get this option from other thing.
So below there's a green button called share screen.
No, actually, I will log in from other mobile, log in from other laptop. Can you check it out?
Or can you share your slides, sir, to Soumya? She'll be able to share it on your behalf.
Yeah, just a minute.
On WhatsApp also, that will be.
Yeah, doctor, have you used the attendees link to join, or like how it is? Other one.
I think I would have joined as attendee.
Okay, one moment. Okay.
There's Dr. Suresh Kumar. Yeah,
I'm
no.
just adding panelists right away.
Fine.
Yeah. All right.
Yeah, this is okay. So thanks for the introduction. I think most of the things have been covered by Dr. Lakshmi. And just I wanted to refresh on certain things, like maybe even she covered the magnitude of the issues. So just I want to highlight on certain things on staging and maybe treatment. I don't want to go like very deep, because that is most difficult part. That will also create most of them will be afraid to hear also. So I don't want to take that so close. So just at least I will go through the awareness part. Maybe why we have been worried more, because breast cancer, or every day in and day out we are seeing many breast cancer patients. So I think the importance of breast cancer has to be we have to highlight, and even not only for breast cancer, for all the cancers. So that the close the care gap was the theme which has been introduced now. So where are all the gap actually there in the screening level in many countries, in developing countries. And as we know that in India, we don't have a screening protocol for most of the cancers. Though we know that we have to get it screened, but we are not doing it because we don't have screening is not made mandatory in our country. But whereas in other countries, US and UK, they have made it mandatory, and so that they can have their own screening, they should have their own screening. Even insurance people also insist on screening. So we need to close the care gap. So once it is screened, I think we'll be able to diagnose it early and also treat them early, and we'll also achieve a cure. Because so what is the cure? Why we are like worried about screening? Because most often what happens is like the target will be the maybe if it is for breast, there will be many reasons like mutation or something hormonal changes, and the years taken to occur as a full-blown cancer, it may be from 10 to 30 years. So these are all the years which we have in hand to get it screened. So there is why the screening plays a role. Most often the screening is effective in only few cancers, like breast cancer and prostate cancer and cervical cancer, because more in lung cancer and brain cancers and all, the screening won't be that much effective because we don't have a lesion that is identified in the early stage, and also there is a latency period is more in these cancers where we can get to identify at an early stage. So why should we like we should be more taking whether it is mostly our people would be scared of cancer? I don't think so, because nowadays everyone is aware of cancer and every one of their families been like there is some other patient in their family. So also they don't want to go for examination, which may be painful. Most often those are the factors which inhibit them from like reaching out the people. I think many modalities, not only even the pap smear was made easy because everyone should get it screened. The same way mammogram has also came into picture in breast cancer. Even there was a lot of controversies in mammogram because the radiation exposure itself will cause cancer. That was a very much highlighted in US and UK, and they ensured that maybe the mammogram frequency of mammogram and how much exposure should it be delivered to a patient, everything they calculated, and though that is a less in severe, we say mammogram in severe. So though there's a less dose of radiation, even we get the same in while we travel a lot in airplanes and all. But still, we should be afraid of radiation dose. What is like what will happen to us? So so data. What is data like? Why we are more giving importance to breast cancer? You see, like breast cancer, once it is diagnosed, cervical cancer is highest in India, and next comes the breast cancer. Whereas if it is diagnosed in early stage, that is in stage 1 to 2. So the cure rate is almost 93 to 67%. Nowadays, with all the chemotherapies available, the cure rate is almost around 75%. Whereas if it is diagnosed in 3B, that is what like Dr. Lakshmi said, if it is gone to a node, it will be in 3. So once it is gone to some node, the percentage it halves, only half of the patient we could save. So why don't we get it picked up in the early stage? That is the question what rises in everyone. So also the risk factors is very high in breast cancer patient. So from the age also, you can see that like from birth to age 39, we are at risk of 1 in 30. That is out of 30 persons around us, we are at risk, one person is around us. Whereas the risk factor increases from ages. So it increases around 1 in 24 in after age 40. Also, there are patients who have a personal history of other cancers or breast cancers or ovarian cancers, and the family history is also playing a major role with almost having a genetic impact, and also certain things. So the risk factor as such, the race is one thing which has been identified in most of the cases, and there are rare cases where the radiation therapy to the chest wall is also a contributing factor. And the late pregnancy or no pregnancy, because pregnancy is a period where we get exposed to hormones. So most often the female will be exposed to estrogen most of the time, and progesterone lesser times. So we need more of progesterone to have to save our breast, because during pregnancy the estrogen will be cut off, and the progesterone will take over estrogen. And during breastfeeding also, the progesterone will be more than the estrogen. So the lesser periods women getting exposed to estrogen, it protects a lot from breast cancers. That is why we advocate an early marriage, a long breastfeeding periods, and these things are being advocated in our culture also. So just because with the statistics and all, I don't think we should be worrying about it, because we should be more proactive in most of the stages, because everyone we are not sure of our life, because we can have a there are many road traffic accidents, many cardiovascular accidents are there. So what can be done? I think cancers are the one thing which can be prevented, and it's also found out early, and also we can cure. These are the things which is coming up now. We should always forget about cancer, and we should follow the things which has been said for longer time, and we should have a routine recommendations on screening. So we should close the care gap, because we need a we have to give more inputs on this gap, because either the person who is having cancer should have an access to the screening system, because most often our villages people are not having that access, and once the access is there, they don't get a treatment. So once the treatment is there, they don't have a social and familial support, because we have labeled cancer as a dreadful disease. That's not the thing henceforth in our even in our India. So as I think Dr. Lakshmi has fully elaborated everything. So this is just as anything abnormal in our breast. Either it can be a lump or nipple discharge or dimpling of the skin, or any pain, or even redness. Even the redness might look like an orange skin peel, and any changes in the texture of the skin. So these are all the things which indicates towards the cancer, breast cancer, and these are all the symptoms. The symptoms are the one which the patient comes with. So these are all the symptoms. So any of these symptoms should be a warning sign, and we should always go for an investigation. That is either ultrasound, mammogram, or biopsy, or even CT. But what can be done? Either whether we can be diagnosed early, whether we can do it early, because the symptom can be found out by the patient early also. The breast self-examination plays a major role. Though the RCT has showed no reduction in mortality, there are the breast self-examination in our group of population. They can find the lump that is in the breast early at the earliest size itself. And once if it is done, then the patient should themselves get a clinical examination by a doctor. Yearly once, that will do. Yearly once they should get an exam by a clinical physician. Then comes the screening mammography. So screening mammography is almost like an X-ray. So for the breast examination, we should also have a timetable, because we should start after our once our period is over. We should start after 3 to 5 days after our periods, and ideally these periods are the one, because this is not influenced by the hormones, and because some before periods it will be painful, and we should not mistake it as a cancer. So these are the ideal periods to have get it screened. So everyone should stand in front of a mirror, and they should always have a check of their lumps. So either by the they should have a rotatory movements. They should have the
excuse me, sir.
Yeah.
So your slides are not changing, sir. So you want to put it on slide sharing mode?
I think it's changing from my end.
You may want to stop sharing and start resharing again.
Yeah, I will stop sharing.
Yes, now it's seen, sir.
Yeah. So the schedule of our breast self-examination. So once it is done, everyone should have a check on their breast with all these parameters. Like they should check in superior and inferior directions in a circular way, and also they should look for their axilla also in a standing position. Also, they have to lie down. They have to feel their breast in a lying position. So then comes the mammogram, because there is a large body of evidence in mammogram which could detect the cancers at the early stage. Even before the appearance of lump, we could also almost always pick up the cancer, because the principle involved in mammogram, because we know that any cancer cells will X-ray, it will look like a salt. Just if you are like spraying salt on a black sheet, like the mammogram will be looking like that. That these microcalcifications will almost always picked up by a mammogram. So that's why the mammogram has become a standard of screening technique. Because all these things it can become, either it can pick up an architectural distortion or any like speculated changes that is around the central focus, or any calcification. As I say, it's very small calcifications and even clusters of micro calcifications can be picked up by a mammogram. So this is the technique involved in a mammogram. So most of them feel that it would be painful. Yeah, it will be painful in a dense press because we have to compress it completely to get an image to be taken. So these are all the factors, and when we should initiate a mammogram is also $1 million question, because there are many school of thoughts saying that we should initiate only from 40 years of age because of the risk of exposure. So that's why I think Nirami is having a like very good effort on these factors. They have considered these factors and they have come up with a very good diagnostic methodology where the patient will be like screened pain free, and also they can get it exposed like n number of times. We don't have limitations with because they don't have an exposure of radiation, and so that we're not limited, and even the images outputs are like we can have a very good maybe we can have a very good suggestions from those data, so that we can always be safe, because once if we are doubtful from thermal analytics, then we can almost always go for further steps. So there are limitations in mammogram also. So once we are there, we should always go. Well, there are many guidelines are there, like American guidelines, which we most often follow, because they advise the best self-examination every month, and almost they should have a clinical best examination for every 3 years until the age of 40. So once if it is their 40, they should include mammogram in their part of screening protocol. So all the other guidelines also like cling on to the same. But why at 40? Nowadays we are facing even cancers at 30. Like every day, like not every day, maybe weekly once or twice I get a patient with 30 years of age. So we should be, I think, these guidelines, we need to be more specific on these guidelines, because anyone who is having a family history, they are advised to even mammogram at the age of 30. And the ultrasound has to be included. Maybe they have to be ultrasound at the age of 25 itself. Nowadays we have started advising. So though these are not in the guidelines. So if at all we are in doubt, I think we should go for a biopsy, because anything which is cancer cells should be proven with a tissue diagnosis, and we should always like go for a confirmative test, because most often we get confused with the lump that may be having a high blood flow, that may look like a cancer, but maybe it would have a different diagnosis other than cancers. So we should always go for a diagnostic tools with either needle aspiration, or if the lump is strong, hard enough, we should go for a tissue biopsy. So there are things which after diagnosis, I think everyone will have a confusion in most of the things, because we don't know like where to stop, and we have a very high difference of opinion, because most of the patient, if they get to have a screen by a surgeon, the surgeon will advise surgery immediately, or if seen by another doctor, they will suggest their own way. I think we should have a tumor board discussion. All the surgical oncologists, radiation oncologists, and the medical oncologists should be there, and they should give their own opinion. And we should have a comprehensive treatment, because those are the things which decide a longevity of the patient. Because it's not simply removing the cancer. Beyond that, we should have, if it is an advanced stage, we should go for chemotherapy, reduce the size of the tumor, and then we should go for a surgery, and then followed by radiation. I think many of them will be afraid of chemotherapy and radiation. Just I wanted to make those things clear, because surgery, I think, like most it is a time tested treatment, but nowadays surgery is like becoming less choice for most of the treatment, because we radiation doctors have taken over for most of the cancers, and we can almost always treat most of the cancers which they cannot approach, and which they have a very high blood loss or even within the brain. So these are the places where we have a great role. So the treatment for breast cancer, it includes all these like this is hormonal tablets and radiation, surgery, and chemotherapy. So nowadays all these things are being incorporated for breast cancers, and in a mix and match way, which after our tumor board concurrence. Most often the patient will be in early stage, they will be needing surgery first, then followed by chemotherapy. If at all needed by radiation. If they don't want to remove the breast, we can just at least remove the lump, and then we can go for a radiation. So these are all the techniques of radiation. We don't want to have a we don't want to get panic about radiation, because most often we are the most advanced advancing in every way, because we ourselves have the most advanced techniques in radiation. So just as a take-home point, we should be more aware of that Indian women are more prone for breast cancer patients. And even any women, like every 4 minutes, we get a woman who is diagnosed with breast cancer. Just we don't want to them get it diagnosed. We don't want to get them screened initially. So these are the factors which take home points, like 1 in 10 to 28 women are like expected to develop breast cancer. So these expectations are the one which prompt us towards screening methodologies to get incorporated in every woman, because 28 you can just get to see any 20 women around you. So once they are getting screened by any methodology, and if any early cancers could be picked up, they'll be in a very good way to get it completely cured. Yeah, sorry. I think my laptop's gone down. Yeah, actually, slide is over.
Yeah, Doctor, thank you, great presentation. Doctor, would you like to join back?
Yeah, actually, the slides almost over. I don't want to take through all management center, because it'll be like really difficult for because we don't want to explain in deep, because they will most often will have a confusion. Everything is individualized, so we don't want to take through those things.
Okay, no problem. So I have a couple of questions which I've already received
Sure.
in chat box. Dr. Lakshmi, could you join back?
Yes, I am here.
Yeah, sure. Great. So the first question is, what are the various clinical considerations as a doctor when opting for newer technologies in the early detection of cancer?
Yeah, the considerations are like we should be clear, like we should be aware of the latency period of any cancers. So when it will manifest, whether it can be founded in an early phase of its progression, because like cervical cancer, the papilloma virus will have an impact on the cervix, and there will be low grade transformations will be there that can be picked up by a pap smear. So like the same way, the cancer should be like we should be able to pick up it in an early phase. That's where the screening plays a role. So these are all the factors which have a more consideration in early diagnosis. And only certain cancers we could make. Nowadays, we are getting certain tumor markers like prostate, PSA, and for thyroglobulin, like for thyroid cancers and ovarian cancers, CA125. These are the tumor markers which also plays a role, but I don't think it will be like that much conclusive in diagnosis of cancer. But nowadays, like many techniques are coming up for an early diagnosis. Probably we will be like having even a blood test could diagnose the circulating tumor cells. Those are all the studies going on. Hopefully, we will get a better technique for each and every cancer.
Thank you, doctor. The next question is early signs and symptoms of breast cancer and how to prevent the disease.
Yeah, early signs and symptoms, I think Dr. Lakshmi explained very well on those stages and all. That's what any change that is that's not our routine. That's not normal to our structural changes. Should be like identified, like noted by the person per se. And maybe treatment. That's what I said. It's very big. It's like bigger C, because an early cancers are treated well with surgery, followed by radiation and chemotherapy if at all needed. And there are cancers which are highly aggressive, and they need a different sort of treatment. And many treatments are coming up with breast conservation, and only we are removing the lump, and the breast is being conserved completely with the help of radiation add-ons. And there are many changes in the treatment protocols. Whereas I think the diagnosis can be made early if something like everyone is aware of the things and everyone reaches out a screening place or a doctor. So it would be very easy for everyone.
Dr. Lakshmi, would you like to add your thoughts on this?
No, I think I did mention in the during my slides as well, and Dr. Suresh covered it completely.
Sure. So the next question is, we have covered about breast cancer in women, and there are cases of men breast cancers also. So there are a couple of questions related to men breast cancer and some of the data. What are the symptoms? What age? Those kind of questions I have received. So maybe can you both touch upon this question as well?
Yeah, male breast cancers. It also happens because male also have the mammary tissue, and also we are exposed to estrogens. Most often, apart from ovaries producing estrogen, most of the women get their estrogen produced from fat cells. So like the same way, even in males also, the fat cells can produce estrogens. So that is the way where the estrogenic effect of tissue multiplication happens, and the male is also like getting cancers. And even there is some strong like genetic predisposition for male cancers also. So we don't want to label like breast cancer is only specific to female. Even males are getting exposed. And whereas the hormonal factors are nowadays coming up because we are exposed to hormones in a hazardous way. Either you take it from milk or like any other feeding foods what we have, and all those things add on to our fats, and indirectly the fat cells are producing estrogen. And even most of the times what we get to hear is like milk what has been given from cow, we don't get it also in a pure way, because most of the cows are being fed with phytoestrogens, and even they have been like given oxytocin or some other injections, hormonal injections, to have a high milk yield. So those are all the things which we also get into our blood. And I think these are the factors which is nowadays it's like we have to be more cautious. And even male breast cancer, I think we should have a I don't know how far a male breast cancer screening will be effective in our scenario, but anyhow, any changes in their own body, they should always have a medical attention.
To add on to what Sir said, the incidence of breast cancer in men is very low. It's 1 in 100 breast cancers that are diagnosed. But having said that, probably the benefit, benefit is not the right word. Advantage is that if a lump happens on a male breast, it's much more easily palpable than a female breast. So one has to be aware that a male can also get breast cancer, and any signs and symptoms that are there, like pain, lump, is also applicable for the men, and they will have to approach a doctor. If there's something called high risk factors. For example, if someone in the family has breast cancer, especially if I'm a male and my mother has breast cancer, I have to be more aware of the fact that I can be prone to breast cancer.
Thank you, doctors. The next question is, can there be cancer without a lump?
Sorry, I didn't hear the question.
Yeah, can there be cancer without a lump?
No, it's very difficult. But the cancer can be there without a lump. That's what I said. the cancer cells will invite calcifications, microcalcifications, and it will also invite high blood flow, because these are the factors. Because the cancer itself, it almost, you can take it as a COVID virus, because it's easy to understand. It has its own mutational form, and it invades blood cells, and it invades its own growth factors for them to grow. So these changes can be picked up, as calcification can be picked up by mammogram. I think thermal imaging could also pick up on changes in the blood vascularity. But it's very difficult to diagnose without lump by a self-examination.
Thank you, doctors. The next question is the role of thermographics in screening for breast cancer in our population.
Sami, your question was not audible.
Yeah, the role of thermographics in screening for breast cancer in our population.
Okay, so thermolytics, which is what I spoke about, is based on thermography plus machine analytics. So there's something called thermography, plus we are adding artificial intelligence, machine analysis to it, and that is thermolytics. So people do have an understanding of what artificial intelligence is. So I'll talk about thermography. Thermography is based on the principle that any actively dividing cell, which is cancer cells are actively dividing cells, have, because of the high activity, have a slightly greater temperature than the rest of the tissue. So what thermography does is trying to map the heat that is emitting from these lesions if they are there. What thermolytics does is it adds on artificial intelligence to thermography, and also there's a lot of difference in the way the cameras have been used. So the studies done decades ago had very low quality cameras, and today we ourselves keep upgrading our phone cameras. So the pixels have improved. So the camera has improved, the technology has improved, and because of that technology and the principle that cancer cells emit more heat, that is what we're trying to detect using thermolytics. So what Nirama's thermolytics does is detect such possible suspicious cases, and then if anybody is positive, refer them to an ultrasound or a mammography, depending on the age.
Thank you, doctor. The next question is, how can we diagnose if it's a breast cancer at home? Does it have any significant clinical signs?
So both Dr. Suresh and I mentioned about clinical self-breast examination or breast self-examination, BSc or self-breast examination. This is how you have to do it every month. You have to feel and see your breast for any changes. The other way, so Nirama's thermolytics, the advantages is that it is portable. So it can be taken to your houses as well. You can schedule a home appointment call and with Nirama, and the device can come to your house and in the comfort of your house, screen you for breast cancer. But all this is not a replacement of the final diagnosis. You will have to go to a doctor after, if there is a necessity for you, if there's any abnormality that's detected with thermolytics, or you yourself feel a lump, you have to go to a doctor.
Thank you, doctor. So the next question is for Dr. Suresh. So how to detect triple negative breast cancer early?
Yeah, we can't detect it because triple negative cancers are the one which will be labeled after a tissue diagnosis. So once if some cancers are lump is there, we get it like a biopsy is being done, either two-cut biopsy or an incisional biopsy. From those biopsy specimens only, we could get to know about the estrogen and progesterone status. I don't think we can detect it early. Whereas that's what I said. Nowadays, there are studies which they wanted, like they're trying their best to find out whether it can be detected early, because triple negative cancers are worst cancers to treat with, and most often the patients will be having high risk features. The triple negative cancers will be high risk features because their parents, like either mother or other women, will be having cancers, and those patients are more prone for triple negative cancers. But we have to be, it's very difficult to find at our scenario.
To add on to what Dr. Suresh is saying, we are right now trying to detect breast cancer any type early. So I think our problem is much more, basic, because I think it's a valid question, because triple negative breast cancer is more aggressive and difficult to treat because they usually come at a later stage because it's very aggressive. But yeah, as long as we can detect any kind of breast cancer early, and that can happen only through periodic screening before reaching a doctor, even before symptoms appear, I think that is when we can detect any cancer.
Thank you, doctor. Next question is for Dr. Lakshmi. Do women below 30 years also require screening?
Like how Dr. Suresh sir mentioned, he is seeing cases which occur in women age 30. We ourselves have seen a woman who's 17-year-old and had breast cancer. Although rare, 17 is a very, very rare age for breast cancer, but there is nothing to stop us from doing a self-breast examination. The minute, that could be your 18th birthday gift to start doing self-breast examination at home, because there's no harm. And that becomes a practice that helps you further on. So there's that way, no age limit to start taking care of your body.
Okay, thank you, doctor.
Sorry, I'll just add on one more point. Mammography is a technique because it involves radiation, is not recommended for women in reproductive age group, which is why Dr. Suresh did mention about the different screening protocols. Right now, the guidelines say above 45, they do mammography, but there are times based on the doctor's judgment, it can be done in younger women as well. I hope I've answered that.
Yeah. So there is one question in the chat box. Can thermolytics detect DCIS?
Yes, it can, because we have seen cases of both ductal carcinoma in situ and invasive carcinomas that have been detected by thermolytics. Thank you.
Thank you. And next is with reference to two cases. Okay, I'm just reading out. The question is, my mother is diagnosed with stage 4 breast cancer and passed away. After 5 years of treatment, I have delivered one child at 28 and another at 37. Will the late pregnancy increase the risk for breast cancer? What kind of measures should I take to decrease the risk in case?
Obviously, high-risk mothers are like, once the age is beyond 32 or 35, we are at risk, because that's what I said. The more you are exposed to estrogen, we are at risk. The more we are exposed to progesterone, we are saving ourselves. So the early pregnancy will almost have an impact with high progesterogens in an early age, and at those ages of 20 to 30s, the proliferating tissues won't be that much enough to get it turned to be cancers with the presence of progesterone. Whereas after 30, like everything, like once the estrogenic impact is there for our female from the age of menarche to these ages. Once menarche occurs around like 10 to 12. Nowadays, it's even happening before like 10 also. So the estrogen phases starts at an early age, and the number of years of exposure to estrogen is a factor which is highly like implicated on the tissue to get it be changed to a cancerous cells. So we are at risk. So, but still, what can be done is like, we should always have a screening. So we can always have a breast self-examination and also clinical examination. And maybe as she said, her mother was cancer, and maybe her hormonal status will also have an impact on our own risk also. So there are many factors, and because most often the environmental factors which the mother grew will also be the same for the girl also. So I think we should have a more like we should concentrate on certain things because these are the factors which can turn like hazardous to us also. So we will be at a risk. Maybe the risk proportion maybe varying, but also to calculate those risks. I think many like indices are now coming up to calculate those risks also. But in a blind way, we should be like we should be having early screening tools, and we should incorporate ourselves like in all our health measures, so that we'll be in a safe zone.
Okay, doctor. Thank you. The next question is how to prevent breast cancer if I am diabetic too? Is there any relation between diabetics and about the breast cancer?
No, as such, not. I mean, but there are many studies like going with this, like saying the cancer cells depend on glucose for their growth. So any diabetic patients will be at risk for more cancer growth. But that's not. It's there's no as such direct causation with it been implicated so far. But what happens is like diabetes, like it almost have an impact on other areas also. The diabetics will invite more fat cells. The diabetes will also have, though in that way, it can invite more production of estrogens. So there are some indirect causations. The causations may be anyway. So health wise, and we almost change our feeding habits after diabetes. So those factors will be or maybe contributing uh, to the growth of cancers, not necessarily breast cancers also.
Thank you, doctor. I have received a couple of questions regarding the hereditary part and cancer. So would you like to touch upon your thoughts on the hereditary aspects and yeah. So hereditary part in cancer, how would you like to touch upon, like if hereditary or if the family
Yeah,
have
actually,
cases?
there was one question that like whether uh, there can be two cancers like breast and cervix. Yeah, there are chances, but most common is breast and ovary, because the BRCA genes, BRCA1 and BRCA2, those are the identified genes so far. The BRCA2 is highly associated with both ovary and breast cancers. So any patients who has been diagnosed with ovarian cancer, we almost always examine the breast also. And even nowadays, we are subjecting them to BRCA also, BRCA testing also, because we can come to know certain things, that whether the same female can get breast cancers, or the female or their descendants will be at high risk for breast cancers. So these are the things we can come to know from hereditary testings. And moreover, nowadays we are having more inputs from other cancers. Like apart from BRCA, there are many hereditary genes also been identified. So I think future will be with all those presentations, and many set of diagnostic studies are there to find out the cancer and the risk the descendants will be getting exposed.
Thank you, doctor. Since you have mentioned about the BRCA gene and everything, so there is one question, like I think it's a patient history. My mom, grandma and aunt were cancer patients. When my aunt, who was breast cancer patient, screened for BRCA, the result was that the variant was observed BRCA2 gene. So what are the precaution tests that me and my daughter should follow?
Yeah, that's what we advise. If it has been identified as a BRCA positive, then they should have an early screening. That's what we say, like even from 25 years, they should have an ultrasound abdomen and pelvis, and also an ultrasound of the breast, because BRCA2 is associated with both the cancers, even some few chronic cancers also. So they should get it early screening, and then in a periodical way. Maybe we usually advise them to have a follow-up yearly. Once in a year, they have to get ultrasound, because ultrasound is not that it's a very safe diagnostic tool. So they should have it screened if it is in a case of BRCA.
Thank you, doctor. I would like to take the last question for the day. Doctor, could you like to highlight a couple of the examination part that you have told, maybe like in few Maybe can you just explain like how the diagnosis can be done, how the examination can be done at home, at what age you can start doing it. Maybe there are sort of anxiety and kind of mental health also associated with, all these things. Maybe your inputs will valuable.
Yeah, the examination per se is like every female should like stand before their bigger mirror that could almost cover up to their complete breast and axilla. And after every menstrual cycle, they should start it from third day to fifth day, and they should feel with the tip of their fingers completely. They should have a like they should like impinge on the breast and have to completely cover all the quadrants, and they should also get their nipple compressed to see whether something an abnormal discharge is coming out. And in the standing posture, they should always like lift their arms up above the like head, and you should see for the like synchronization between both the breast and the nipple level also. And apart from that, they should also visualize the axilla to have any like swelling like things in the axilla. And so from standing position, they should also get it lied, and also they should do the same thing in from all quadrants in a superior to inferior way, in a horizontal way, and also in a circular way. So through all these maneuvers, there are chances that we could pick up a lump if it is in a size of even a 0.5 to 0.5 centimeter. More, I know few women have picked up in an early stage also with just breast self-examination. So that will be helpful. That will be very much helpful for us and also for the patient, because we can achieve almost a complete cure. So if it is early stage, if it is less than like very small sizes, we can almost have the breast conservation surgery, because we have to remove a lump with a good margins, and the radiation will add on to the removed area, and the breast is almost saved. And there are persons like who are having a very long life. So I think everyone should have a early diagnosis with the help of breast self-examination monthly, and a clinical breast examination early by a doctor. And they should go for mammogram from the age of 40, and even with other modalities coming up like Nirame, and they should almost have a early screening modalities. They should get exposed themselves to all these things, so that we are in a very good safe zone.
Doctor, also would you touch upon the mental health aspects when you treat breast cancer?
Yeah, mental health. Yeah, we don't want to worry about it, because nowadays any issues we are facing, we should. I think nowadays, like we are getting very good exposure in Google, and if there is a lump, it can be a fibroadenoma also. But with the help of all these things, we don't want to think it as a cancer. And we rightly, we also have other nearby hospitals to get it cleared off from the like worries, because once it is a fibroadenoma, we can just do a needle test and we can find it out. And even sometimes with the ultrasound itself, we can label them as a fibroadenoma, and Virat scoring from mammogram. All these factors are the things which help us to diagnose it even without any invasion, so that they can be safe. And I don't think we have to worry on it, because we have every technology with us nowadays. Maybe 10 years back it was a big worry, because we didn't have technology, and also even diagnose, we didn't have certain treating modalities. Nowadays it's not so. We have everything with us, and I think everyone is having a doctor nearby, at least in Tamil Nadu per se. Maybe we are not having such situations, but psychological impact, I don't think it should be taken, should be worried of.
Thank you, Doctor. I think we have taken up all the questions and the cases that we have received till now.
Soumya, I think there is one question. Sean Thomas is asking the sensitivity of thermolytics in differentiating inflammation versus cancerous lesions. One is we've been able to detect both inflammation and cancer lesions. For example, recently we could, when I say we, I'm saying thermolytics could detect 2 cases of tuberculosis. But how do we differentiate? That is where we hope the clinical history will be useful. If it's something acute, then we'll be able to differentiate information from a cancerous lesion. I hope that answers your question. I saw a couple more questions. Unfortunately, by the time I had to drop out and I can't see those questions. We really hope we have answered most of them. I would like to add, Dr. Nandita, would you like to talk about home screening?
Yeah, sure. So Niramai has a screening service available at home itself. So you can easily book your appointment for a home visit by visiting our site and clicking on the book appointment as a home visit. So we are available in Bangalore, Delhi, Chennai, Hyderabad, Mumbai, Pune, Vadodara and Ahmedabad as well. So it will be like, or for even for any other queries related to breast health screening solution, kindly visit our website at niramai.com.
Thank you, Dr. Nandita. To add on to that, Samya, probably what we did realize, especially during COVID times, is that not everybody was comfortable getting out of the house and going for a mammography test. And that is when we conceived this idea of screening at home. And that has, to some extent, reduced anxiousness that you speak of. And having said that, when you go for cancer treatment, most hospitals do provide counseling, not just for the cancer patient, but also for the caregiver, which is often forgotten about, but it is available. And the conversations are much more open today. I think the problem that exists is the lack of awareness. I mean, it's like how Dr. Suresh said, we know that there is breast cancer, but it's the belief that I will not get breast cancer. And as long as we are open to have conversations about breast cancer with our spouse, with our parents, with our siblings, and I know not just related to a women's health, like one of the things I asked you is how many men have registered for the webinar, because it's important that the male members talk about it. Some of us are greatly privileged, but that's not the case in the rest of the country. And usually it has to be a man who has to take the lady, his wife, to the doctor. So he needs to be aware about the disease itself. So many of the women I spoke to tend to put in, the husband's health, the in-laws' health, the parents' health before theirs, and they tend to ignore and wait until it becomes really unbearable. Even if they have a symptom, they wouldn't talk about it in the house because they prioritize something else. I think it's very important that a woman realizes that she needs to prioritize her health, because only when she is healthy, she can provide for the health of the rest of the family. So I think the important takeaway is talk about breast, remove the stigma, remove the taboo, talk about breast as much as you can. Kitty parties, any kind of function, breast health should be a conversation there. And if one person is able to talk to 5 people today, I think we'll reach that awareness that it can happen to any one of us, and we should all be prepared for it. And the best way to prepare yourself is like how you go get a blood test done every year to check your health, go get a breast and a cervical cancer screening test every year. Thank you. Thank you, MedPiper. It was great using this opportunity to talk something which I'm very passionate about. Thank you, Suresh sir, also for your kind inputs. Thank you.
Yeah, thank you everyone for joining us today. And I would like to thank all the corporate organizations and medical colleges who have nominated their staffs, to participate for this important, awareness session on breast cancer. And have a good evening. Thank you.